Hey guys, welcome back to another video. It's been a little over 2 weeks now since my double jaw surgery that I had to correct my underbite. I will say that I'm doing a lot better now than I did the last time I made my video. Um, I'm gonna just kind of talk about my experience and the process of going through this, and hopefully for those of you also going through this process will have some comfort knowing that it does get better, but it's gotta be worse before it gets better. Like I said before, the very first few days are the most difficult of them all. Right at the day after the surgery, and even the few days after you leave the hospital to kind of go back home and get readjusted. The next big challenge is modifying your diet and eating. It's really tough to have to eat from a syringe. So, a lot of the cases I just drink Ensure. I have, I bought a large pack from Costco. And then I picked up so I have a chocolate and a strawberry flavor. I also drink like a drinkable yogurt you can buy, some juices, things like that at the supermarket as just kind of a quick fix for you to drink. As far as food and what I eat, I tend not to eat too much. I just eat enough, maybe like one. So I'll usually ensure I'll drink that in the morning, at lunch, and for dinner. But it's like lunchtime, maybe dinner. What I'll do is I'll cook like some sort of stew, usually like canned stew or whatever. Maybe like sort of like pot roast or some sort of like spaghetti based one, and then I will blend it in the blender and basically puree it to the point where I can easily put it on a syringe and push it into the side of my mouth and consume the food. Basically, the food kind of seeps through your teeth, and you just gotta make sure that you brush your teeth and you use the whole warm water and salt mixture when you're cleaning your teeth. So I just do that every time I eat a meal. As far as physical movement, everything feels a lot better now on my face. I feel like the swelling's gone down a bit. My lower chin, I'm still having a hard time feeling it. I'll notice that if something drips on my chin, I won't notice it at all. So I'm very conscious of that. So I'm very careful, always making sure that I don't drip any food. But there's still very little feeling here on my lower chin. My lower lip is tingly here if I touch it. My cheeks, I can feel them. There's no problems. Other than that, I've been craving the need to just open my jaw, and I think that's gonna be one of the toughest things about this entire process is the desire to just wanna open your mouth and open your teeth. You just want to bite and eat something. So that craving and the desire comes and goes, and it is I'll just say very frustrating to have the feeling. I don't have my appointment until next week, so I got one more week to go until I see my surgeon, and hopefully by then they can start removing the bends and allowing me to sort of exercise them. I saw a blog where somebody went through a very similar exercise, and what they started to do, and even their doctor suggested, was to start moving your lips to kind of exercise them. So I normally move my lips anyway when I'm talking, so that my mouth starts to get adjusted to excuse me. So my mouth starts getting adjusted to the new structure. But other than that, I'm starting to get used to my new face. Uh, to a point where I feel like it's very normal. I know your miles may vary for different people, but I'm very happy with the results right now. I don't know if they're still swelling. My chin feels weird, obviously, because my chin did shrink considerably. Like my face got shorter, and my cheeks kind of got more pronounced. And it's basically what the doctor was saying early on about the structure of my face. So, that's that. I stopped taking some of the pain medicine. I started taking very little of it maybe about a week ago, and kind of now I don't really need it. So maybe about a week and a half into it, you'll probably stop needing the medicine, maybe even earlier. But like I said, one of the biggest things is that you're gonna have this desire to just wanna eat, open your jaw. Sometimes your family will bring food like a pizza or hamburger, and it's kind of hard to be there and eat. I actually did blend a pizza a few days ago. I got really tempted, so I made like some, like a spaghetti canned vegetable stew or whatever. And then I just shoved that pizza in that blender and I blended the crap out of it until it was pureed. One thing I'm gonna say is make sure you use a strainer, the metal grate, to filter the food before you eat it. Because there was one time I had like a chicken Alfredo kind of base, and I put in some chicken in there and I blended it. I didn't strain it. So what ended up happening was that my teeth, the little gaps in my teeth, actually got clogged. And so I couldn't get any food in there, and it was such a pain just to try and clear out the food out of my teeth. So make sure you blend your food and you use a strainer to really make sure that the food you're eating can be strained out and eaten properly. Again, as far as eating, I just take my time. It takes a little bit longer. I do a lot more cleaning now because I have to clean the blender and prep all the materials. So just be patient with yourself and just go through the motion, go through the process of just getting all that stuff done. So it's just a part of the process. But like I said, I'm just hoping in another week when I see my surgeon that they can finally remove some of the bends and I can start practicing and opening my jaw. I do crave food once in a while. So I'm pretty sure once I can start opening my jaw and start eating some soft foods, I'm probably gonna start doing that. I don't know if I told you in the last video that they actually chipped my jaw. I don't know which side it was, but I forgot. I think it's this one. They chipped it, and they used titanium to put it back into place. The surgeon said it'll be good, and it just said that it would make the recovery process a little bit longer. So, but I'm not having any complications. Everything seems to be going well. Again, I'm just getting used to my face. I do go out in public, I go shopping, I go buy groceries. It's always a little funny trying to talk to people with my voice, and no one's really, doesn't really bother me, so shouldn't for you either. Other than that, I really don't have anything else to say other than if you are doing the surgery, I will say it's worth it. I'm not even at the end of it, but I really will say it's a process worth going through if you really want to do this. It was tough in the beginning, but things are getting a little bit easier. I'm adjusting to the new kind of diet that I'm on. Other than that, everything's good. With that said, I'll catch you guys next time. Maybe I'll make another update video in another week and let you know how I went with the surgeon. Alright? Talk to you later. Bye.